The Ministry of Finance has released 10 billion naira to support domestic vaccine production to tackle the COVID-19 pandemic in the country. The Minister of Health, Dr. Osage Ohanire, made the disclosure at the Presidential Task Force (PTF) on COVID-19 briefing in Abuja. He urged Nigerians to ignore claims by some people in the country to have COVID-19 vaccines for sale.
The Ministry of Finance has released 10 billion naira to support domestic vaccine production. While we are working to develop our own vaccines, Nigeria is exploring options of licensed production in collaboration with recognized institutions, and we're also exploring the option for local production of vaccines. I advise all citizens to disregard these claims. They are not genuine. Some of them may be criminal. There are procedures for vaccine acquisition and use, which include appropriate regulation and certification by NAFDAC. I advise against fake vaccines, as there is no vaccine approved yet for use in Nigeria, and the National Primary Healthcare Development Agency is the only authorized vaccine administrator in Nigeria, which means that 1 of every 5 persons tested last week turned out positive, compared to the previous week, which had a positivity rate of 14%. Our total number of confirmed cases stands, as already said just now, at 110,387 of a total of 1.172 million samples tested, with a cumulative positivity rate of 9.4%. 1,444 cases were recorded in the past 24 hours, with sadly 77 deaths in the past week, and total fatality of 1,435. It is instructive of the second wave of COVID-19 that all cases recorded so far in January make up about 20% of all confirmed cases we have in Nigeria, more than the whole of December, and barely halfway through the month. There is no question that we are deeply into the second wave of the pandemic, which requires that the PTF and Federal Ministry of Health will review strategies to respond to the challenge and take additional necessary measures to check this case deluge that can threaten our health system's capacity to cope. Federal Ministry of Health is outlining 3 approaches to confront the pandemic. The first being the infection mitigation, which we have been doing up till now, which we intend to strengthen. Second being therapeutics, and the third being the vaccines. Super spreader activities that involve congregational settings, which must be reduced, restricted, or perhaps even prohibited in the interest of the common good. With regard to therapeutics, we are striving to reduce mortality from the disease by ensuring adequate stock of supplies and strengthening our case management capacity. Case fatality has dropped to about 1.3%, but that is no comfort given the volume. And in this regard, the Ministry of Health is working to expand oxygen availability across the country, as strategized by the PTF, to address shortages which have been a challenge globally, and also to review the value of various pharmaceuticals and protocols proposed for COVID-19 treatment. Clinicians are urged to work out guidelines for participating in clinical studies for ivermectin,